There's a few reasons you absolutely cannot take HRT, but a few things that are more common sometimes get lumped into that batch. Hi, I am your local OBGYN. I love women and let's talk about it. I'm always sort of faced with patients who are talking about things like family history of breast cancer or something like family history of a DVT. And are these things absolute reasons that you can't be put on hormones? If you are not well versed in hormones, you're going to want to avoid the things that you just don't know. So somebody who's well-meaning is just going to say, nope, not going to do it because I don't want to cause you a problem. And there's enough data and research that's out there at this stage of the game where we can at least make informed decisions, and it's never a clear yes or no. I'm going to say something that's ironic. There's never and always and never in medicine. So there's always a gray zone that we work in because nothing is inherently all good or all bad. So if you have a family history of a DVT, all right, but you don't have a personal history of a DVT, you could consider hormone therapy. If there's something that has a strong genetic predisposition to be passed down in families, like a dominant type gene, you may want to see a hematologist and just get tested because that would be helpful to know. However, if nothing comes up or if you've never had a history, you may want to consider it. You have to be counseled that there's risks, but there's always risks in these things. And then if you have a family history of breast cancer, that sort of plays into 1 in 8 women are going to get breast cancer, and the majority of them are not genetic, at least by what we know in 2025. The data shows that family history is not an absolute contraindication. Again, if you want to have zero additional potential risk factors, then you stay away from it. But if it's something that you are educated on, what we know is that if you introduce hormones in the setting of a family history, again, the exposure is probably still less than what you were making on your own prior to perimenopause and menopause. And if you utilize it and then stay on conservative doses, it may be the right move for you.